and we are back for part 2 of A Nightmare in Boston. Boston Children's Hospital performing gender mutilation, body, total destruction surgeries for children. This is the nation's first gender clinic. They are paving the way to hell for these trans-identifying children and their families, and for the rest of us as a nation and the rest of the world. So I was trying to go through everything and figure out, where do we want to start with next. We just gonna have to just go through this piece by piece. This is horrifying. So in the last stream, we covered the fact that Children's Hospital of Boston, Boston Children's Hospital, I don't know why that's such a tongue twister for me, is offering cosmetic hysterectomies for children at a pediatric level. Let's see what we can and also if you haven't, please like the stream. I gotta remember to ask that. Like the stream. If you're not already subscribing, please subscribing. If you already subscribed, please hit the bell so that you can get notifications anytime that we go live, so you don't miss any content. I try to stay up to date with everything that's going on in the gender world, and it is exploding. So it's like I'm trying to catch as many of these balls as possible. Please like the stream. Please subscribe. Please comment. Do all that sort of stuff. All right. So it's horrifying. So this is also follow me on Twitter if you can at ASTFXX. Alright, so this is my Twitter feed. So this person said, for fuck's sake, we really do need to protest outside of Boston Children's. I live in the Boston area and could possibly assemble few local turfs. If you live in Boston, I'll fly out to Boston. I mean, if somebody wants to help raise me money to get out there, but I will fly out to Boston. I have a bullhorn. You guys organize it. I'll try to get there, and if I can't get there, I'll get you some turfs out there. We'll get you some real turfs who know what the hell's going on. Quantum Origami says, I don't know how this got so far so fast. If you told me in the 90s that this would be happening to kids now, I would have thought you were insane. So, hey dear, how are you, honey? Yeah, I think that I think that's what we're all trying to figure out, and I think that that's what's really scary. But I'm trying to find this Business Insider that was talking about like the history of Boston Children's. Let me see if I can Boston Children's Gender Clinic Business Insider. Damn, I just hate Business Insider. Largest ever. Schools are. Oh, God. All right, well, let's just take a look at this part. Right? Demand for transgender medical care is exploding. Now, this is written in 2016, okay? So, this was Business Insider wrote this on Boston Children's Medical. Again, they are a pioneer of... I refuse to use the term gender-affirming surgeries. So I'm going to use the term genital cosmetic surgeries for children. I mean, transgender cosmetic, it's what they are. Do we have a term? Trans surgeries, cosmetic surgeries, genital mutilation surgeries for trans identifying people. Transgender people don't exist. You can't change your gender. There's no trans. You're not transitioning from anything. You can approximate the appearance of a vagina or a penis, but even then, you can't. There's no transition, And I listen. I support adults' right to. I support an adult's right to alter their bodies in ways that they want. What I stand against, no child has the agency to make these sort of life-altering decisions for themselves. So totally no child should be exposed to any of this. As for adults, I believe that adults have the right to access these sort of things. And I think that it needs to come with really explicit, clear, blaring neon warning signs, a full, just disclosure of all the possible risks. I think that, detransitioners need to really be amplified. We need to be clear about what we do and do not understand about the long-term impacts of these procedures. And I think that, physicians that offer this need to be held at a very high standard, and there needs to be a limited amount of accreditations given out to physicians. It can't just be every plastic surgeon can now start to offer transgender care and start, promoting it and marketing it. There needs to be, it needs to be like a liquor license, okay? Because the fact of the matter, the way that the market works is that, we can create everything. It is about supply and demand, right? But you can create a demand. How do you create a demand? You create a sense of needing something that people didn't realize that they needed. We're creating this social contagion, right? I think that if we have a very small number of physicians that have to meet very, very high ethical standards of care, and again, at that point, these adults can recognize the risks and assume them, and it's like kind of like, listen, this is what you really, 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 really want, but it's not gonna, you're never gonna have full genital functioning ever again. Your lifespan may be impacted. You're going to be dependent on exogenous hormones for the rest of your life. You're going to be a lifelong medical patient. You're going to have just genital atrophy, a variety of problems, skeletal muscular atrophy. Your osteoblasts are going to be impacted. You're going to have, increased risk of osteoporosis, increased risk of early dementia, increased risk of, poor sexual functioning, and I do believe that, as an adult, if an adult wants to make these decisions, okay, full disclosure and just, letting them know that this is a purely cosmetic thing. You're never going to have full range of function again, but absolutely not should Medicare be paying a dime for this stuff. Medicare can pay for the best therapy, counseling that money can buy for people, fine. Medicare should not be paying a dime for men to get breast implants, for women to have pieces of their thigh cut up and rolled up. And I think that any parent who has not explored gender exploration therapy, which is looking for alternative ways to explore different gender expressions, that while still kind of affirming that you are the sex that you are, should be thrown in jail. Any parent and anybody, any physician, any psychologist, any school counselor, any parent, anybody who is found to be in violation where they haven't at least, done, before even allowing their child to, socially change, whatever. All of this stuff has to be explored. Gender exploratory therapy is a highly underutilized tool. Why? Because you can't charge as much money for it, because it resolves the problem. What do you think, when we're looking at long-term costs, what do you think is going to make more money? The gender exploratory care, where you let the child, be gender nonconforming, and you talk with them about how, boys can be a range of different things and like a range of different things, and, sexuality can manifest in a lot of different ways, and things that they're feeling and experiencing, and tapping in with these, feelings of femininity while still affirming their sex. Or gender affirmation care, which is saying, you're right, anything you want is correct, whatever you're feeling inside is right. Not only is it right, we need to get right on it. Make sure your puberty is on the horizon. We need to race against the clock. It's a race against time. We need to halt the puberty. Make sure this whole idea that puberty blockers can be reversed, no they can't. Okay, especially not if you go and top it off with cross-sex hormones. Puberty blockers plus cross-sex hormones, when taken in conjunction with each other, result in sterility 100% of the time. And I'll say that again. Puberty blockers taken in conjunction, followed up with the administration of cross-sex hormones, meaning the wrong sex exogenous hormones in the body of a developing child, results in sterility 100% of the time. And we're talking about kids 11, 12, 13 years old who do not have the capacity to give consent. The prefrontal cortex is not fully developed until the age of 25. The frontal lobe, it processes and understands long-term consequences, that can plan, that can, envision a future, that can understand, cause and effect, is not fully developed until the age of 25. We're taking 9 and 10-year-olds. Matter of fact, let's look at where this starts with them. This is all a big experiment. This is all a big experiment. I'm eating my kids' snacks. All right, look at this. Billboard Chris posted this. Hold on. Boston Children's Hospital prepares children for their 10th birthday, which is when they get individualized plans that include puberty blockers, cross-sex hormones, and chest surgeries. My son is 11. And Joe said, I'm not sure if you've touched on it yet tonight, but the UK Tavistock Clinic is likely getting sued by close to 1,000 families. Close to 1,000. They're getting sued by hundreds of families for their absurd procedures. This is a very interesting precedent. Let that be a warning. Shots fired. Shots fired. We need to bring it all. We need class action lawsuits. Over the next 10 years, every single person, Shapeshifter, Abel Garcia, Kat Cattinson, every single detransitioner, Tulip R, all of them. We need to gather people. We need to really rally people together. We need to hit them where it hurts. This is inspired and motivated by money. So let's take it to the bank. We need to come for them over and over and over and over till it's impossible for them to get back up financially. We are. We're talking about 4th and 5th graders. My son is 11. My son is 11 years old. I couldn't imagine doing this to him. My 3-year-old daughter says she's a boy. Sometimes says she's a boy. She one time even literally told me she wishes she had a penis. It was so random. And I just, okay. We just like, oh, well, that would be silly, huh? And then that was it. And I was like, you want some snacks? She's like, yeah. She goes back and forth between liking boyish stuff to liking playing dress up and girly stuff with her big sister. She doesn't know what she's talking about. And, I taught my kids all the terms. They know what, like, their vulva is. They know what a vagina is. They don't say, like, my PP or my, like, the JJ. Like, my kids, since they're, like, 1 and 2 years old, can identify, like, my vagina hurts or something, the boys have penises, all that sort of stuff. So they have language for this stuff. Kids are just, once they have language for stuff, they're putting ideas and concepts together. I can't imagine. I would be on the process of mutilating that beautiful little girl, rather than saying you're fine the way you are. You're beautiful. You can do all those things. If you think that you need to have a penis to do the things that you think that people, boys are allowed to do, and you're not, well, let me let you clarify right now. You can do whatever. Any of it. It's heartbreaking. Judy C says, I have a 16-year-old and I cannot imagine being told to celebrate if he wanted to be trans. I would really move. I would pull my kid out of school. I'd move to Peru. I want to do that anyway. I'd be like, yeah, we're out of here. You fucked up. If I had heard like school call me and be like, we need to sit down and talk about, your daughter's, or your child's gender identity. We've been talking to, I'm not going to tell you my kids' names, but we've been talking to Susan, to little Susie. She's not feeling too much like a Susie. She feels like a Samuel. Do you want to let them know Samuel? We've been calling him Samuel, and we've been using he, him. Okay, Mom? I'd be like, bitch, you got me fucked up. Yeah, cool. You know what? Oh, okay. Yeah. Back away slowly. Get in the car. Get out of here. Don't ever talk to me or come near me or my child again. Ever in your life. I would be so out of there. I would sell my house. Pack up. We're out. We can't live in this country anymore. We're gone. I would go build a hut. Mech says there's no way I'd leave my kid in some crazy groomer school. Yeah, fuck no. I would homeschool my kids. You would have to like. I would leave the country if it were ever like on some type time where like they were like getting a little like pushy about it, and I thought that there was a chance that they would try to like coerce me with like children and youth or CPS. I would leave the country. I would go to Mexico. I would leave the country. We'd be out of here. Your Munchie Mama voice cracks me up. I know too many of these imbeciles. So anyway, all right. So Billboard Chris posts, for children 9 and under, the hospital helps facilitate a social transition that prepares them for their 10th birthday, which is when children are offered individualized treatment plans that include puberty blockers, cross-sex hormones, and chest surgeries. Vaginoplasty for 17-year-olds. Jesus Christ. Boston Children's Hospital boasts for a full suite of surgical options for transgender teens. Has 90 videos promoting surgeries to youth on their YouTube page. Co-director allows vaginoplasty on 17-year-olds, but hints at even younger. That's what I'm saying. They're always like, well, we'll do it on a case-by-case basis, which basically means any age is fine. Any age is fine. This is just what we're going to tell people. All right, so look at this. Like, I'm sorry, and I hate to say it, but look at this. This kid's voice is so creepy sounding. Look, they ruined this child. Listen how creepy this girl's voice sounds. And it's horrible because she's a victim. She truly is. She's a victim. But this is horrible. Look what they did to this kid.
So are you going to school in your normal school?
No, I'm still online.
You're still online. Still getting out more than you used to, doing more exercise.
It's so awesome just to be normal.
Okay, and like, the fact of the matter is, you guys can get mad at me for saying this or saying that I'm like shaming or whatever, okay? Listen, kids are very sensitive to like superficial stuff. We have a probably morbidly obese teenager who is, suffering from, acne, who's overweight. I mean, you can already tell kind of has this like weird way of acting that like probably spends a lot of time online. And it's like, what's one way to sort of cover up whenever you feel like you have some sort of shortcomings or you're not happy with yourself or, you're going there. It's an escapism. It's I can be someone else and it'll if I'm not succeeding in the ways that I want to succeed, I'm not happy with my body, I'm not happy with how I'm doing socially, I'm not well this can be the excuse. This is why I'm not functioning in school. This is why I'm not functioning socially. I'm not, because I have this issue that needs to be resolved. And then it's like, oh, it can be that rather than like, oh, I'm just having a hard time. Let's look at it. This is again, and because it's such an easy, quick way to get so much attention so much love bombing so fast. These kids, you should see how they reinforce these kids when they like come out as trans. I mean, they love bomb them. Oh wow, you're so wonderful. All of a sudden you go from being kind of like a frumpy, like, regular awkward, overweight teenager to being, oh, now you're this real special brand of person and everyone wants to be close to you so that they can use you to virtue signal, because they can sit there and be like, I stand up for my trans friend. It is him. He's a man. No, they're not. That is his chest. You don't, again, because again, there's a codependency. You got to understand this layers deep, and anybody who understands addiction will understand this. They always explain to you, addiction is not an individual disease. Addiction is a family disease. Okay, this is a communal disease. This thing you have doctors who now are getting super interested. These doctors, listen, when I had cancer, I see how excited doctors kind of get when it looks like they might have a chance to like problem solve something. Like, ooh, what? Because like when I was saying, I was like, I really want to avoid going into menopause. I had a couple doctors like, okay, well, we could do this and this. Like, all right, here, we'll call you back. Well, they want to like, they get tired of doing run of the mill procedures because there's not a lot of glory in that. You have to understand with their colleagues, and it's even like my lawyer. It's like whenever I can get him to do something like complex, he like loves it. Because it's like, ooh, rather than like a run-of-the-mill thing, they want to, because then they can promote that. They can say, oh, look, I did this rare, unique procedure. I did this rare, unique thing. So you have so many layers of social pressure. You have doctors who are like pushing, who really like, oh, it's your choice. We can get it done soon, but it's your choice. But, if you do want to do it, we can do all this and da-da-da. You got to understand, every time you take one step further, it's one more commitment in, and it's harder to take a step back. They say, oh, it's all reversible. But when you have so many people who are like, you feel like you're letting people down. You have parents now that are like on board. Any parent who's taking their kid to a gender clinic secretly is like into this. Well, that's not true. That's not true, because there's some parents who genuinely don't understand and are so captured, and so again, and also again, at the end of the day, we're supposed to be able to trust physicians. My God, we're supposed to be able to trust these institutions. We're supposed to be able to trust the American Academy of Pediatrics, which, don't even get me started, that's a whole other thing. You have all this institutional capture. So these parents who are looking it up online are seeing all these major accredited organizations, these professional organizations that are co-signing this. You have these physicians that are, giving you the green light, these educators that are giving you the green light. So now the parents are on board. And then, you have a whole social circle. All of a sudden, these kids are chronically online. I'll bet you anything she's probably on Reddit fighting with TERFs. I'll bet you anything she's created an identity around affirming this for herself. It's giving her like a new sense of community, a new sense of friends, an online life. And then, maybe whatever friends, that she has in the real world, again, it's a community disease. It's like addiction. People get addicted to the addict. People get addicted to the dysfunction of it all. That's why people enable an addict, because they for some reason, it's like they become codependent on the person's illness. It's the same thing with this. I guarantee you, she probably has friends who like love to hang out with her now that they can use her to virtue signal to everybody else. Be like, oh, look, I have a trans friend, and I'll stand up for my trans friend, and we'll do like writing assignments being like, when my friend came out as trans, I knew that I had to be the one to affirm her, like all this sort of stuff. So you have so many people who are like hawking at this. And again, for a little while, you feel special. No offense, but you're going from being like an overweight, kind of like just like awkward looking kid, to everyone all of a sudden now wants to be around you and is so interested in you and is affirming you and praising you, and you feel great. You feel, you're, of course you want that. You want more, but it's just like, it's like chasing a dragon. You need to ramp it up. It's not going to cut it, because also it starts to wear off with everybody else. Everyone's okay. You got the haircut. First thing was the haircut, was so exciting. But then everyone got used to you having the haircut, right? You know, then you had to change the pronouns, and that was exciting. And everybody was like, ooh, and it caused like a big stir. And everybody's all like, okay. And the teachers are saying, wow, good for you. Now you can come out to the teachers. Okay, great. Then you change your name. So now you can scold people for dead naming you. And another thing it does, it gives kids a sense of power. Because now they get to like, they can scold their peers for you know, either dead naming or using the wrong pronouns or not understanding things. And a lot of the stuff is just made up. But they can explain what being trans is. They can be an authority on something that it's all imaginary. So it doesn't matter what they say. It's all about how they feel, right? So they can teach people stuff. So now they have a certain sort of like social authority over other people. You know, and then people are rushing to hit her defense to be like, that is a man, that is a boy, he's a trans mask. You know, they come up with all these terms and stuff. It gives them a sense of power and identity. They can shut people down. And then also even just stuff like, you get this power online. Like in Twitter, someone says anything against anything that she says now, she can have them deplatformed. She can have them, you know, their posts removed, get them, you know, put in timeout. I mean, it's so like, of course, I get it. My God, I get it. And then it's the excitement of like changing your body. And then, you know, that first hit of testosterone, hell yeah. Testosterone would make anybody feel amazing. Testosterone? Women take testosterone to be bodybuilders. That shit gets you like jacked up, like physically and emotionally, and it gets you like going. It's a drug addiction. They get addicted to the testosterone. They get addicted to the attention. They get addicted to the opiates that are prescribed with these procedures. You get procedure after procedure after procedure. And also, it gives you an excuse not to function in life. Oh, well, she's trans. Well, no wonder she hasn't really been, you know, going to school or doing well. We got to resolve the trans thing first. And it's an excuse to just focus on yourself 100% of the time. I'm developing my identity. Then you don't have to worry about things like college. You don't have to worry about things like getting a job. And if someone doesn't want to hire you, well, they're a bigot. It's because I'm trans. It's not because I've just fucked off on Reddit, you know, 21 hours a day. Or I've been masturbating for like 15 hours straight and just slopping around and eating garbage, straight up garbage. I'm sorry, no, like, it's so hard for me to understand how young kids can get so overweight. Kids are so active naturally if you like make them be outside, but if they start getting addicted to technology, that's how kids can get this morbidly obese. And I'm sorry, it's child abuse. It is so sad for me to see kids that are this overweight. You're supposed to be in the prime of your life, and this didn't happen overnight. The parents have checked out a long time ago and are now trying to backtrack and like come up with these bizarre easy fixes. Sometimes the answer's simple. Slow down, pay attention to your kid, sit down, have meals together, provide healthy food, turn the fucking TV off, get these fucking iPads out of here. You know, put child locks on the cell phone so they can only use certain functions, or if they can, you know, get on the internet, there's a certain amount of time a day. Plug the fuck in, pay attention to your kid. Your kid is desperate for attention. Clearly, is self-medicating with food, self-medicating with gender ideology, self-medicating with the fucking internet, self-medicating with all this superficial likes and attention and reaffirmation and gender shit. Plug in. Your child is desperate, and of course this feels good. How many meetings are we going to have talking to this kid about her identity and her gender and her feelings? She doesn't even have to focus on anything else because now everybody just keeps having meetings trying to understand this special thing that deep down she knows is bullshit. It's so fucking sad, yo. This kid would feel better, honestly, if she got outside and started like being active and exercising and eating better. And again, all the bullshit processed bullshit food that we're putting in our bodies, it's fucking with our hormones and our endocrinology. So of course we feel all weird. Did you know? I'm going to make myself big for this. And I'm going to look directly at you because this shit blew my mind. Did you know that the average male today of this generation has the same testosterone levels of men from several generations ago at 65 years old? We have a crisis. It's happening in our bodies, and it has to do with what we're putting in our bodies. These kids are being affected. These kids are growing up on fucking garbage food. There's a reason I bust my ass to grow food. And no, it's not just so that I can like take pictures and post it on here. Yeah, that's like a nice side effect. There's a reason I go out and I dig out my backyard and I plant a bunch of shit. Because I don't trust the food that's out there. I don't know what the fuck they're putting in it. I'm not putting the stuff into my kids. I can't protect them from all of it, but I can do my best. My girlfriend is over here making our own detergent with soap nuts and shit like that. Our body is an organ. Like I'm telling you, like I have my this is my right here. This little tiny thing is how I get my estrogen. My estrogen patch is this. 3 days, there's a tiny little bit of gel on it. I absorb it through my skin and it changes how I feel. It's insane. If that doesn't tell you how much the stuff that we're putting on our bodies, it's messing with us, and we're wondering why all of a sudden we have an explosion of kids who bodies feel out of whack. Our endocrinology impacts it is like the connection between our minds and our bodies. And when we fuck with it, there's so many things we know that impact testosterone, that impact estrogen. And these poor kids. This poor girl. This poor fucking girl, yo. Come on. Listen to her voice. This breaks my heart. Listen to her voice.
It's so awesome just to be normal.
Yeah. I'd always been interested in LGBT health, and when I started my internship, it really did give me a passion for both working with trans people and making it possible to improve their access to care. It's just really important to me to provide
me, I, what I want. It's so, oh God.
trans affirming care, but also to enable others to do what they can to make all healthcare services more trans affirming. I'm Liz Bosky. I'm a social worker for the Center for Gender Surgery at Boston Children's Hospital. We have one chest patient today. They actually affirmed their name at 16. Okay, so they've been affirmed for a really long time and have a really stable gender identity. Social workers.
So since 16. So if the child is still being seen as a child, well, I guess until 18 or something. So the kid has been affirmed for what, a year or two? And now he's getting chest surgery. Chest surgery. I never, not one time, never, as a teenager, thought about breastfeeding my children, my future children. That never crossed my mind. I never thought about how I was going to feed my kids. I didn't care. It wasn't on my radar. Hold on. I always, and the crazy thing is too, hello? Okay, sorry. I always knew I wanted to have kids, but I never thought about things like breastfeeding. I didn't know that stuff until I was pregnant for the first time, and now I'm learning about breastfeeding and making these decisions. And breastfeeding was one of the greatest things I ever did. And like I said, breastfeeding is important because it's a natural protectant against postpartum depression and bonding disorders. You know, and I know that it's a very politically charged issue. Never in my life would I shame a mother for choosing to forego breastfeeding. That is not my point. That there are a range of reasons why moms choose not to breastfeed, including just not wanting to, and that is legitimate. But a lot of women do want to, and a lot of women are unsupported in doing it, and we know that there are real benefits. You know, and to rob children of this during a time. I was in Antifa when I was 16. I'm like a conservative now. I was in like a radical anarchist, you know, shit stomping group. If I had to somehow be frozen in time as an Antifa member, now at 35, a decision that I made when I was like 14, like if it was like, oh, I'm locked into this ideology, you know, I would have to say like, yeah, fuck world trade, man, and like all this like stupid stuff that I used to believe, all this stupid stuff, and I had to be like locked into. I'd want to kill myself. That's what we're doing. We're locking kids in to their 16-year-old ideology and saying, well, you're frozen in time now. It's crazy. I never thought about breastfeeding. Kids don't. But oh my God, breastfeeding. I cried when I knew it was going to be my last time breastfeeding my last daughter. I knew I was never going to have another child again. And I will never forget the time that I had to bond with my babies, and it was just a way to like reconnect, and it's over now, and I'm so glad that I had that. We're robbing children of stuff that they don't even understand that they're being robbed. Chest surgery, you piece of shit. Look at this fucking clown with his dumbass haircut.
These are so important to patient care. One of my major roles is helping patients and families advocate for themselves, understand the information that they're getting.
Do you hear like the self-importance in this fucking dipshit? I've really been interested in trans affirming care since I was like a gender studies major in college, and I really like helping families advocate for themselves. I really feel like really special when this is what I mean. Everybody is just leeching off of these kids' cases. Everybody wants a piece. Everybody is getting something out of this. Everyone is somehow like affirming their own journey. They should be in prison. They should be in prison. Every single one of them should stand trial for this. Stand public trial while we all watch. It's fucking sick. Savior syndrome, exactly. Yeah, I love helping my patients. All she says is I, me, my, transgender care. Fucking loser. Whatever boxed hair color you bought, that shit looks like ass. Like you look mentally ill.
And make their own decisions. Being able to enable patients to make the best choices for affirming their gender, that's really what my hope is for the center. Not all transgender people want to have gender-affirming surgery.
Yo, like literally 25 years ago, this person wouldn't be able to get a job anywhere. Like people would take one look at her and be like, "Yeah, like I'm really sorry, hon. Like, can we refer you to like a psychiatric like inpatient? Like you look like you're struggling." Now they're like, "Yeah, come on in." They're taking all these like mentally ill people and giving them like, you know, top priority, you know, employment status. Fuck's sake.
But for those who do want the surgeries, they can be life-changing. We're not changing someone's biological sex. What we're doing is allowing them to affirm their gender through surgery.
I'm so confused. How is it, if gender has nothing to do with sex, then why is affirming gender involved in imitating the genitalia of the opposite sex? I don't get it. I thought they had nothing to do with each other. You people make no fucking sense. Oh, God. How many children are we going to harm? How many kids is enough, you scumbag? How many breasts do you want to destroy? How many women are going to go through childbirth and pregnancy knowing that they'll never be able to nurse their baby and never get the naturally... Again, it's not just breastfeeding. People don't... I know it's hard to understand if you've never done it before, why it's so precious, why it's so important. There are so many factors involved. For the mother and the baby, both of them, it is a protectant against stress, against anxiety, against depression, and it fosters bonding. There's a reason why when we introduced artificial milks onto the market, why we saw an explosion of postpartum depression that we are still grappling with today. We have to look at the implications of every piece of technology we have. I'm grateful that we have artificial milks. There are some moms who really need it. There are some moms who really want it. But we've always got to weigh the cost-benefit analysis. But slicing off the breasts, the healthy breasts of children, you're saying that sex and gender are two different things. You old... I'm not going to make any ad hominems. You are saying that sex and gender are two different things. But then you're giving us some sheepish, incoherent blather about how mutilating the genitals of children to approximate the appearance of the opposite sex is affirming in their gender. I thought they were not related. Lady Elizabeth Bosky. Keep these names in your head. Elizabeth Bosky, PhD. What is MPH? Who knows what MPH is? License something of social work, clinical social work, Masters of Social Work. What's MPH? Masters of Psychology. Maybe Masters of Psychology, Masters of Social Work, license something, clinical social worker, PhD. I'm sorry, no offense. Like, none of these credentials are like in any sort of hard sciences or like anything that can be like tested against anything. It's all a bunch of like soft bullshit. Masters of Public Health, thanks. Oh, God. No, so yeah, this person is like the psychologist. Oh, God.
Makes them feel more affirmed in the gender with which they identify, as opposed to changing anything fundamental about their identity. Yeah.
Yeah, if somebody sliced off my clitoris and mutilated my vagina, my first, reaction is not going to be like, oh, yeah, that wasn't, like, fundamental to my identity. Yo. It's pretty fucking fundamental. Is that how you sleep at night? Is that what you tell yourself? I think, like, and I'm sorry, this person looks fucking ridiculous. You can tell that this person has been on testosterone for, like, a year. Look at these kids. I'm sorry, they're turning them into freaks. I'm sorry. It's ridiculous. It's ridiculous what we're doing. It's goddamn ridiculous.
You said that your chest felt weird.
Because, I still have, some, bumps here, and then, bruising, not actually bruising, it just feels like it, on my ribs, but, other than that, it's fine.
But other than that, it's always, I love it. I'm happy with everything. But, I'm, it's, again, and then it's oh, it's all this stuff, but again, these kids feel Thank you. Thank you so much. Thank you for your passion and work in defending women, lesbians, and gay men. I know it's not easy to go against the homophobic trans code. Thank you. And Chris G, please don't castrate yourself. You'll become docile. Thank you, both of you. Chris and Reverend Coffin's other son. Thank you guys. You guys, the support really, 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 really means a lot. It really does. And thank you. Oh, you guys, I hope I don't sound like a lunatic. I feel like one right now. Like, it's really upsetting to me. You know, like, this feels real to me. And I know, and it's scary because, you know, my son's in middle school, and I know that this is going to impact at least some of their friends, or at least the children around them. You know, I care about kids. I care about kids, you know. It's just kind of wired in me, and it's making me sick and sad. And so I really appreciate you guys' support a lot. This stuff is just nutty.
We encourage patients to do what they want and not what they don't want. And I think
Oh, wait, you guys can't hear me. You guys can't hear that. Oh, God, I keep forgetting. I gotta turn this up.
have to help make it okay for patients to affirm their gender in the way that makes the most sense for them.
Thank you, CV. Thank you for affirming that I don't sound like a lunatic. That makes me feel, I feel like one. That makes me feel better. Ah, for fuck's sake. All right, what do we want to look at? Understanding gender dysphoria in children and teens with Dr. Daniels. Or let's see, surgical transition, who is eligible. All right, let's do this one. I'll try not to talk too much over it so we can get to the other one. Do we see this one yet?
Parents ask, how would I know if my child... Hi, my name is Mark Daniels, and I'm a pediatric endocrinologist at Chalk Children's Hospital. I'm the division chief, and I'm overseeing a new program called Gender, Puberty, and Sex Development program at Chalk. Gender is the sense of self, of who one is in the world that we live in. And so gender really is not defined by what you look like or what your body looks like. It's who...
Oh, well, Dr. Daniels, that's great to know. I guess we can all go home, because if it's not defined by what your body looks like, then all this gender affirming care is just a bunch of bullshit, right? Well, never mind, guys. Stream's over. Like, you know, we've solved the riddle. Gender's done. I figured it out. Dr. Daniels here clarified that, like, this shit has nothing to do with anything. Don't you people understand how circular this is? How can you look yourself in the mirror knowing that you're spinning people? You're just spinning like a fucking top. And these parents, these dumb parents, I'm sorry, not everyone's intelligent. Okay? And that doesn't mean you're a bad person. There's some people who just aren't that smart. And it's not that they don't try. It's not that, you know, it's some people just don't really got it in them, okay? They want to be good people. They want to do the right thing. So they look at Dr. Dipshit over here for answers. And they were going to trust that he knows because, hey, he's the doctor. He went to all the school. He passed all the boards. They hired him. And he's spinning them in circles. And there's a point where they're like, I'm a little confused. This doesn't like make a whole lot of sense. But, you know, Dr. Dipshit said it's the right way. So I guess, you know, we got to listen to the doctor, huh? You know? And this dickhead goes home, probably jerks off in the mirror, and is just like counting fucking dollars. Oh my God. You look like you have erectile dysfunction. Like, I put a lot of money on the fact that you probably get hard maybe 30% of the time. Dickhead.
Who you are inside. Gender dysphoria is the sense that there is some distress or stress related to the fact that how you see yourself is not how the rest of the world sees you. And that can lead to anxiety and depression. So the dysphoria is when your understanding of who you are does not match with what the rest of the world sees. Sometimes people do not feel that they are the same gender as what their sex at birth was. So those people can generally be considered transgender if they are considering themselves the opposite gender of what they were born.
Yo, they're all just making this shit up as they go along. They're all just making it up. Like, no one's saying anything. If you really listen to these people, they just spinning like a top. They're not saying anything. They're circular arguments going round and round. He's got like turkey spots. Like, why are we listening? God, I hate these people. I'm sorry if anyone gets offended. I hate these people. I will make very...
Or gender nonconforming, which just means they're not meeting society's understanding and norms of what gender is. When someone is transgender, oftentimes the first question people ask is why? And the answer is we really don't know. It can be a mix of many different...
Well, Dr. Dipshit, don't you think, maybe since we really don't know, we might want to, pull the reins a bit on all of the, massively life-altering surgeries, Dr. Dipshit? Shouldn't we be like, hey, what if this really is like a social contagion thing? And it's crazy because they'll sit there and tell you, oh, we really don't know. But then we suggest, hey, could it be social contagion? They're like, absolutely not. How dare you get out of here? And we're like, well, didn't you just say that you didn't fucking know? So maybe you should, count it out as a possibility. Because, it's kind of looking like that way, considering when the, map of 2007 had one gender clinic and it was yours, and you guys radiated this shit out. And of course, I don't know what else happened around that time. Was it smartphones? Let me tell you something. In 2006 was the first time I ever got a smartphone. Prior to that, only like a few people I knew had smartphones. People in high school did not have smartphones. In 2006, 2005, my ex-husband, I went to college with my ex-husband. He was one of a few people I knew that had smartphones. We still had flip phones. Then it was around 2006, 2007, it was half and half. And then within the next year, it literally went from everyone having smartphones. Everyone had them. What do you think changed, Dr. Dickhead? Everybody got on the fucking internet. No, it's not social contagion. We just don't really know. I take 17 fucking pounds of Viagra a day, and I can only get hard about 30% of the time. Yeah, thanks a lot.
Different things, including genetics and culture, environment.
That's what I mean, though. Social media. At least before, I used to... Okay, listen. When I wanted to go on Facebook, I used to have to go on my laptop. When I was in college, if I wanted to go on Facebook, I used to have to wait to get out of class. I would go back to my apartment, I would set up my laptop, and I would go check Facebook. Now, kids do it literally in class. Kids do it while they're taking a fucking dump. Kids do it while they're cooking. They're doing it all the time. When you have it like that, it just becomes so interwoven in your world. I could actually differentiate the real world and the, internet. Around 2006, 2007, that's what changed. Everyone got smartphones. Everyone got online. They had Instagram. Okay. Instagram in 2009? Oh, no, not even 2007. It was 2010. Instagram in 2009, it was you would get if I got 3 likes on a photo, I'd be like, oh shit, this photo is getting crazy. And if you got 10 likes on a photo, it would give you a special thing because it was oh shit. Because again, these were brand new technologies. It was learning how to interconnect things. The algorithm was still evolving. Okay, Facebook, everyone was on Facebook. Then Instagram came, and then Facebook. Do you know? Okay. Do you know how I got on Facebook for the first time? I had to wait until I had my college, my new college email address. Because back then it was still the Facebook where only people in college could get on it. You had to have a legitimate college email address. In 2006 is when I matriculated in freshman year of college. That's when I got my email address. 2007, this is when this stuff was just starting to take off. Just starting to take root. I think it's hard for us to even recognize how quickly things have changed. I remember when TikTok first came up and I was like, ew, isn't that like Musical.ly thing? And it exploded. Exploded. Oh yeah, but we don't really know. We don't know. We just know that it's not social contagion because, because then we'll be liable for literally like damn near criminal liability because of the things that we've done. So yeah, but we actually really need to make sure we convince you that it's not social contagion, because if it turns out that it's social contagion and we've butchered little kids and we've cut off clitorises and we've removed, had radical hysterectomies of 15 and 16-year-olds, yeah, we're pretty fucked. So yeah, that's off the table.
But in truth, we don't have any test that we can do, such as a blood test or an x-ray. Many parents ask, how would I know if my child has a gender issue or is gender nonconforming? And the real answer is listening. The real answer is trying to understand when a child is expressing something, what that may mean to that child. So some children will, at a very early age, as soon as they can talk, will tell you that they're being told that they're a girl when they're a boy, or they feel like a boy, or vice versa.
Oh my God, don't you understand? Do these people, did this dickhead actually graduate medical school? Or is he like a paid actor? Because if you knew anything about even just the most rudimentary, elementary level psychology, he would understand that children, babies, are glued to watching their caretakers. They're glued to watching their caretakers. And if mom is giving subtle hints that she expects her son or daughter to be a different way, kids can pick up on those things. Kids can pick up on those things. And in the very tiny, minute, possibly real population of people who potentially had some sort of, androgen exposure prenatally that may have impacted their brain, or there's basically one of the theories, and it's actually one of the theories of homosexuality as well in men. And this is why, okay, I'm going to do my best to explain it as I understand it, okay? So if I fumble up, let me just explain this really quick. One of the theories of homosexuality and how it happens in the brain is that prenatally we know that mothers who have multiple sons, who've had more than one son, the more sons that a woman has, the more likely the later sons are to be homosexual. And the theory of this is that when women have a male fetus, I think it's because of like the Y chromosome. There are some, and because the child, produces androgens, you have to understand we go through prenatal puberties, right? We go through puberty around 6 months, and this is to aid in genital development. And actually, male fetuses have a prenatal puberty at about 6 months gestation, about 25 weeks gestationally, that is actually has higher androgen than they will when they have their adolescent puberty at 13, 14. The purpose of this puberty is to develop the fetus's genitals. The mother's body has to develop a certain resistance to the androgens. And sometimes her body can create an over response to the androgen that doesn't affect that fetus. However, it can affect later fetuses, male fetuses. And it blocks androgens. So it is possible that and they think that this is linked with homosexuality, and it can possibly have, something to do with this gender shit. It happened. It is a tiny amount of people, and it would explain whatever. What we also know is a lot of times that if this is true in like kids that they think that this sort of, prenatal exposure happened to, it eventually corrects itself through normal puberty. So maybe the kid ends up just being a gay kid, right? Maybe for a time, because it hasn't been corrected by the next layers of puberty. Again, we have like 3 different puberties. Because it hasn't been corrected, that maybe they confuse it with being, oh, maybe it's because I'm really a girl or whatever. And it has something to do with the endocrinology. Once they go through puberty, a lot of these kids grow out of that feeling of feeling like, oh, I'm actually a girl. The very tiny, minute amount who don't, whatever. We know what aggravates it. Affirming these kids with cross-sex hormones aggravates it. It pushes them even further into feeling like, yeah, I'm transgender. They get these feelings of that. Shapeshifter talks about this. He said that when he started taking estrogen, that his feelings of being like, wow, I really am a woman, like skyrocketed. Once he stopped taking the estradiol and the estrogens, and started taking testosterone, he said it was like a fog lifted over his eyes. He just felt totally different, and he finally felt like he was back in his body again. And it was like this weird, like crazy thing where his perception was like different. We know that upwards of 85% of children, if they are not affirmed, will grow out of it. The balance is that you don't affirm them, but you also don't like reject them with it. You just say, listen, you are what, whatever. You allow kids to explore with gender nonconforming stuff. Eventually kids come back and feel at home in their bodies over time, especially as they make it through puberty. We rob them of the chance to feel better when we put them on puberty blockers and when we give them cross-sex hormones. Again, what I just outlined is a theory. I probably didn't explain it perfectly well, but I spent a long time reading about it. It's just a theory. The rest of this stuff is a mixture of social contagion, depression, self-harm, and I think our obesity problem and our processed food problem has a lot to do with it. The foods that we eat impact our endocrinology. It impacts our estrogen functioning. It impacts our testosterone. Like I said, men of this generation have the testosterone of 65-year-old men in the previous generation. And you can see it. I'm sorry to say it. You can see it in a lot of men. I think it has a lot to do with the lifestyle, has a lot to do with what's in our water. They said that there's a lot of estrogen in the drinking water because ever since women started taking the pill and peeing in water, and the treatment plants can't remove all the estrogen, so I think a lot of men are actually drinking estrogen. And it's not, I know it sounds like tinfoil hat a little bit, but it's actually not. Because again, from everything that I've heard, talking to detransitioners and listening to people who've transitioned, all this stuff, and also reading what the literature that we know, is that playing with kids' hormones will change how they feel about themselves. Go back and listen to Shapeshifter stuff. Listen to him explain how I felt while he was taking estrogen versus how I felt when he was taking testosterone. The same reason why kids who are allowed to, who are socially transitioned, are tenfold more likely to medically transition. They, begin taking cross-sex hormones, then they're almost like guaranteed to pursue like further intervention if they can access it. Because again, taking the cross-sex hormones can impact how they think. It affirms, it makes them feel and also I read all of like the brain scan studies that again ended up like are basically bunk. But there might be like a small, slight structure in the brain, but it's really more associated with homosexuality. But they said it means that you have a transgender brain. First of all, it's bullshit, and it's just like it's so vague, and they don't understand what these structures are. And maybe slightly, but what they do know is that the difference in the structures that are apparently more similar to female, it gets aggravated when they are put on estrogen, and when they're having like supplementary testosterone can resolve it. So we know that doing cross-sex hormones aggravates feelings of gender dysphoria. Doesn't resolve it. It makes it feel, not aggravates it, but it aggravates the sense of like, I'm not the gender that I was born. I hope that makes sense. Microplastics. Yeah, a lot of it. A lot of this stuff.
Actually a boy, but everybody is calling them a girl.
Bisexual women, I think, has a lot. As a bisexual woman, I think bisexuality in women has a lot to do with the fact that it's like an evolutionary strategy of being like sexually like malleable. I think the bisexuality in women has to do with an evolutionary sexual strategy in the fact that if, evolutionarily speaking, if we were to lose a male partner, like male partners were only really necessary in terms of like insemination and sort of stuff, and then if we were to lose, it's good to be bisexual and sexually elastic, because like say we were to lose a partner to either he's off with something else or he dies or whatever, then you could have like partnerships with women, and then you have other support networks that help you raise kids that doesn't necessarily result in you getting impregnated like more. You know what I mean? I'm getting tired, but I have a whole theory on bisexuality in women that I can explain. Let's just finish this dickheads thing.
Girl, or making them wear dresses. And this is actually oftentimes very distressing to a child. So that would be one of the first indicators to some families. Some kids are very private in that, and they can make it until adolescent or even adulthood without anybody knowing. So
those are the AGPs. So AGPs don't start feeling gender dysphoric or whatever until about 16, 17, until about puberty. So it's not that they were quiet about it. Everybody's afraid to say that they're an AGP. So everyone pretends that they're a homosexual, transsexual, and that they've known since they were 4. You even hear Bruce Jenner being like, oh, I had a feeling, and then, I went on to being like a pro-Olympian and all masculine in every way possible, but nobody wants to admit, because the second you admit that you didn't have those feelings at 4, then everybody knows you're an AGP, right? So the reason why I didn't feel it until you're either an AGP, if you're a boy, if you're a male, and you start to feel dysphoric around teenagerhood, you're an AGP. If you're a female and you feel dysphoric around teenagerhood, then you're an ROGD. Actually, you're an RGD regardless, and it's social contagion. I mean, you're ROGD, or, possibly linked to autism, or, otherwise the other option in women is just really, it's like internalized homophobia of lesbians. So
sometimes there's no way for a parent to know this. However, if a parent is clued in and gives the child a sense of safety and space to express themselves, children will often be able to give you hints and clues and maybe sometimes direct information that they don't feel like they're treated in the right gender for themselves. If a parent or a guardian starts wondering if their child...
Listen to this dickhead. Oh, yeah. Your child isn't even old enough to speak yet or to formulate language or to even understand any of this stuff, but look for little hints and clues. You'll know. And then you get these like loser parents who start to they're looking for something. If you're really looking for something, you're going to find it. You'll find whatever it is you're looking for. You're looking for transgender clues, you're going to find transgender clues, because that's what you're looking to see. That's what you want to see. That's what you're going to see.
child has a gender nonconformity or is transgendered, the first thing they should do is try to understand where their child is coming from. I do want to say that this is not easy on anyone. It's not easy on the children. It's not easy on the parents, not easy on the siblings. It's something that we as a society are starting to understand more and more about, but is still very different than what our classic society has accepted. Once there is starting to be more information and ideas that there is a gender nonconformity or someone who is not following our typical gender ideas, then
What is our typical gender ideas? What are you talking about? Well, like I'm supposed to go be making a sandwich right now? Should I go be like scrubbing something and sucking dick? Like what would you prescribe for me, sir? What's my gender role? Tell me what I'm supposed to be doing. Because I don't feel like a woman, so maybe I'm not living up to my role. Come on, bro. Fuck are you talking about? You sound fucking stupid.
families should really reach out to a medical professional like their pediatrician or to a counselor. The idea there is not to try to change the idea of the child or
You
the
hear
mind
that?
of the child, that we can fix.
Don't try to change it. Don't try to challenge it. Once you see those clues and you're locked in, that's it. Don't even try. You're playing with fire. If you even so much say, hey, you think that this might not be that? No. You gotta go. You just gotta go with it. You gotta blindly follow us all the way off the ledge and just jump. That's all you can do, or else your kid will commit suicide. That'll be your fault. You wanna? What would you rather? Would you rather a dead son or a living trans daughter? Huh? Hey, not my kid. Choice is yours. Like this is how these scumbags talk to these dummy parents. I'm sorry, but you gotta. I'm sorry. Listen. I'm not the smartest person in the world. A lot of us aren't all that, I might not be the smartest person in the world, but if someone's trying to, don't these parents start getting down this path? And isn't there a point where they're like, hey, you know what? No, this doesn't sound like a good idea. I'm not going to do all this shit to my kid's body. Like, what kind of parent really sits through these things and is like, yeah, okay, yeah. And I'm sorry, a lot of this, I really believe a lot of these are either women with, really, weakling, low testosterone husbands or, no husband. And there's, a weird, mutual dependency on the child where they have a weird kind of emotional, an inappropriate emotional reliance on the child. And I've listened to some of these moms, these mothers of trans kids, and they're very emotionally dependent on the child and inappropriate with the child in an emotional way. It's single moms who have a son who almost treat the son as platonic boyfriend. I dated a guy like that. He was in a marriage with his mom. It was so weird. But non-sexual, but I was ew. You're ew. I'm sorry. I douchey man. Here we go.
That issue, but really to offer a sense of safety and support to really be able to explore this a little further. So right now, our goal here at Chalk is to offer a comprehensive approach to children with gender issues and other issues. This will include a medical.
Arden, how sick would you be if your parents put you on puberty blockers and you I always think about that. You when you ended up with Jazz Jennings and just never genitally developed. How much would that fucking suck? I literally think about it. I'm sorry. I've said it before, I'll say it again. I love sex. It's one of the greatest things on the planet. I love it. I mean, since I discovered it, it's. I don't know how people are celibate for years and years and years. That's great. I've done it. I've been celibate I'm celibate right now. I mean, my boyfriend is away. Okay, I think it's good to take time alone, but my God, if I just couldn't have sex anymore, and I literally thought that there was a chance when I was going through cancer treatment that like it would numb my ability to experience an orgasm, I cried so much over that. I was like despairing about it. I was like rolling around in bed, like acting like I was like my life was over. My boyfriend was like, "You need to stop. Like you're being so dramatic." I'm like, "You don't get it. You're gonna be able to have an orgasm, and I don't think I will anymore." It's like fine. I can, thank God. Holy fuck. Who wants to live like that? How does that make things better? God.
Medical care, adolescent medical care, therapy, counseling, and access to resources. Our goal here is to offer gender affirming therapy. We want children and adolescents to actually feel comfortable.
Yo, this is why fathers are so important. So Arden says, "Oh God, I could have been so manipulated. I could have gone down that road for sure, but my dad was a real man." I'm sorry. This whole thing, like, we have neutered men because, like, listen, toxic masculinity is real. Don't get me wrong. But now we've, like, conflated, like, all masculinity with being toxic. Men are supposed to hold the line. There's a reason why women are, like, more empathetic and, like, more soft about things. There's a reason. It's good that men aren't as empathetic as women. And I know rad femmes get mad. Like, oh, yeah. Whatever. Men typically score lower on empathy than women. Sorry if that pisses you off. It is what it is. Okay, but it's a good thing because in terms of parenting and stuff, like, moms will, like, kind of let certain things go or be softer about things. And dad's like, no, not with the fuck shit, not with the fuck shit. I always knew, at least my dad, I knew I could get away with certain shit with my mom and whatever. My dad wasn't fucking playing, you know what I mean? And it was good though. Like, he wasn't like, he was just like, no, no, you need to do, whatever. Like, and like, it's good to have that balance. It's good to have like a father who is paying attention and isn't with the fuck shit. Boys need that. Girls need that. You need the parent who can like set the firm boundary and be like, no, we're not fucking doing all this weirdo gender shit, Sharon. No, I'm not having my son chop his dick off. Fuck are you talking about? Are you out of your mind? Matter of fact, I'm filing for divorce. I'm getting full custody. Don't ever come near me and my son again. Like, that's the type of shit. Like, what kind of a real man with his balls in a vice is be like, oh, okay, well, I guess we'll just start calling him Karen from now on. I have a daughter now. Come on, bro. Like, ball up a little bit. Be like, no, you're not doing that to my son. Fucking you talk. Jazz Jennings' dad. See him like, oh, well, Jazz, your new girlfriend. Look at your big boobies. Get them big knockers, Jazz. Yo, you fucking weirdo. Look what they did to your son, dog. Like, look what they did to your son. I would not care if I had a gay son. That's the problem. That's the problem there. We need to liberate men from being disappointed with a homosexual son. I know so many homosexual men, gay men who are like real men. Like real men who are like solid men who take care of shit. Fucking like have all of like the good qualities of masculinity. And I'll say this over and over and over again. You can be a real man with flowers in your hair. You can be a real man and homosexual. You can be, that you can still be masculine as shit and like technically feminine things or wear like floral shirts. That doesn't make a difference. It being, masculine is about like what you do in this world, your self-confidence, your, willingness to do what's right and to take care of responsibilities. That's what we needed to liberate. We didn't need it. No, they took it too far. And it's like, no, we didn't mean like literally cut your son's dick off. Like, Jesus God, no. We just said, calm down. Just let the kid like wear flowers. That's all. Like, chill out. Pendulum way overswung. Jazz's doctor needs to be in prison. Why is it my boyfriend spent 14 months in an upstate prison for one marijuana plant. One dead marijuana plant. 14 months in an upstate prison for that. You got scumbags like Jazz Jennings mutilating the healthy bodies of children. And he's out there driving around in a Porsche. Shit is disgusting.
In expressing who they feel they are, not what the world thinks they should be.
Soft men make hard times. It's hard times make strong men. Strong men make good times. Good times make weak men. Weak men make hard times. We are in the weak men having made hard times phase of things. That's fucking great. Yeah. Glad I got born into this. Alright, we're just gonna watch. I'm really tired, but I promise that we're gonna watch this one last thing. We'll just keep going through these because these are a living hell. Oh, the Department of Urology. That's scary. I'm sure it's about me. Alright, hold on. Let's see. Where's the one that I chest reconstruct? Jesus Christ. Oh, good. There's Colin. Where did it get? What does it mean?
Most people, I think of gender transition as a finite, defined set of series or steps that changes one's appearance to align with their internal sense of gender. But actually, it's not really the case. People can start their gender transition at any point, and it may not ever end. And it can be anything from a social transition, that is changing a name or changing gender markers or pronouns, to hormones, to surgical.
Have they answered one question?
Most people, I think,
have they answered a single question? Can anyone like raise their hand and let me know of all the questions that they like said that they were going to address? Have they answered a single fucking question at all? Because I'm like stupider now that I've sat and listened to all these people talk. And I use the word people very lightly.
Think of
For fuck's sake. Oh, God, kill me now. Kill me now. Here we go.
the eligibility for getting gender-affirming surgeries at Boston Children's Hospital is basically the same as it would be for most other hospitals or surgeons in the United States. And that's the case because we all follow the World Professional Association for...
Next, you guys don't get this side of me usually, Meg. I don't usually stream at this time. This is me at my like deranged hour. I've no more I can barely function. I'm just totally grumpy. That's very accurate. After this, I'm gonna go get my cat and force him to cuddle me, and we're gonna go to bed. That's like all I want in this life.
Transgender health, or WPATH standards of care. For top surgery, you are requested, but not required, to have been on gender affirming.
Oh, requested. Oh, we just hope that, whatever you want. The patient's in control. The 10-year-old gets to decide. The 10-year-old. And not to forget that WPATH, the world... Wait, the world... Oh, fuck. What does WPATH stand for? Something of transgender health, whatever it is. It's basically who sets the guidelines for transgender health. Not to forget that one of the contributors of WPATH is one of the founders of the Eunuch Archives, which is like a hardcore fetish pornography and pornographic story site that has to do with self-castration and just general castration. So just in case you were wondering like what type of people are behind these organizations like WPATH who are informing the standards of care for Boston Children's Hospital. Well, there you go.
Affirming hormones for at least a year. If you're a trans woman, it's really encouraged that you be on estrogen for at least a year because you want to maximize your natural breast growth. Many surgical centers require you to be 18. At Boston Children's Hospital for top surgeries, we'll see people as young as age 15 if they've been affirmed in their gender for a long period of time and don't really have any other life complications that make surgery inappropriate.
A long period of time. Well, what's a long period of time there, Elizabeth? What is a long period of time? Like, there you go. I'm gonna give there's a dislike. How do you only have? You probably have I bet you ratio's crazy. I don't know. They've only had 701 views. Fuck this person. Are there any comments on here? Mine is not working. Oh, here we go. Alright, there you go. Doing my part as an American.
You also have to come in with what we refer to as the letters. One of those letters is from the primary care provider or the hormone prescriber, basically saying that you've been diagnosed with gender dysphoria, that this surgery is appropriate for you, that you understand the surgery, that there's no medical reasons why you can't have the surgery. The second letter is from a behavioral health provider, diagnoses you with gender dysphoria. A really good letter shares your gender history, and they tell us if there's anything we need to know about your mental health that could affect your eligibility for surgery. Looking forward to genital surgeries. And
yeah, because it's, the kid wants to amputate her breasts and the boy wants to invert his penis. I wouldn't necessarily associate that with being mentally ill. No, that's a normal, reasonable request. Otherwise healthy. Bro, what? So what you're telling us is that there are no standards of care. Standards of care. The 10-year-old decides. Let's hear Elizabeth's take on. You know what? Actually, I like her glasses, but I'm gonna lie and say that they suck. That's like the only good thing is her glasses. Oh, you guys missed it. What else? What other comments should we leave? What should we say?
These were really started age 18, age 17 for very few transgender women where it's really appropriate. You actually need a second letter from another behavioral health professional.
Well, thank God. Thank God that to get genital surgery at 18, you need not just one letter of affirmation, you need two. But don't worry, all of the clinicians are in-house, so hopefully you'll get it. Wink wink. Like, bro, these are all just like fake hoops that they're like, oh yeah, you have to get a second surgery, but don't worry, we'll send you one now. It's so. We're gonna listen to it again really quick. For the genital surgery, just
transgender women where it's really appropriate. You actually need a second letter from another looking for your mental health that could affect your eligibility for surgery. Looking forward to genital surgeries. And these were really started age 18, age 17 for very few transgender women where it's really appropriate. You actually need a second letter from.
I cried my eyes out listening to Shapeshifter. I actually, right before this, was just watching part of that stream again because I hadn't watched in a while. My heart is broken for Shapeshifter. I think about him a lot. I literally do. I think about him and I just imagine what that life is like, knowing that you were genitally mutilated. My clitoral sensitivity, and sorry if this is TMI, but whatever. My clitoral sensitivity is like slightly diminished from radiation, and I like act like I'm like my life has been like destroyed. It's like really makes no real difference. But like even that I like mourn. I mourn the like tiny nugget of like differential between what I could feel before um radiation versus after. And they're just doling these. I guess sometimes it's acceptable for 17-year-olds to have for transgender women. Why are you calling it trans women if it's a 17-year-old? That's a trans girl. It's not an adult. It's not an adult. Where do you get your hair color? Do you buy it at CVS? Like, everything about you is annoying. Like, literally everything. I actually like your glasses, but I insulted them anyway because you suck.
I'm another behavioral health professional. And the purpose of that letter is to make certain that you understand the fertility implications about the surgery and you're really making an informed decision to eliminate your future fertility potential if you haven't already banked gametes or done other fertility preservation.
Wow, the evil, the evil, the evil, the evil. And this is what this is all about. Transitioning banked gametes. It's all about transitioning to artificial reproductive technologies. I'm really starting. I'm actually getting to the point where I'm starting to be like more and more like almost just against artificial reproductive technology, like across the board. I don't think a lot of it's okay. The banked sperm, the getting a random sperm donor, the in vitro fertilization, the surrogacy. Let's stop playing with kids. Not having a child isn't like a human right. Let's stop using kids as like a science experiment. Let's stop, disconnecting them from entire branches of their family. Let's stop, we have a bunch of frozen embryos and we throw a bunch of them out. What the fuck? What are we doing? What are we doing? It's disgusting. Oh, and again, it's all this wasted medical resources on this frivolous, ridiculous, nonsensical stuff. And if you really have the stomach for it and you really want to vomit, go and try to look up some transgender porn that are like post-op. And you don't see a lot of post-op trans women using a vagina, do you? I actually have tried to go on a porn site to like see if I could see what it looked like. I like wanted to see in action, like if it works, and I like can't find any. It's bad. It's bad. All right. I gotta go to bed. Let's just see if there's like one more.
Long-term implications of chest reconstructions are several. Important for the patient to remember that this is an irreversible procedure. The patient will not be able to breastfeed in the future, and to the
Yeah, Meg says, I don't think any reproductive tech is necessary. If you aren't down to adopt, then you need to find something else to do with your life. You can't, don't want to. I fully agree. I fully agree. The only reproductive technology that I think is fine is like Clomid. Clomid is like a follicle stimulator. It like, if you just need like a boost with like your hormones or something, but that's like you're stimulating your body's able to do. It's like if your body's having difficulty maturing one of your eggs, it like helps your body mature the eggs. Clomid, I think, is like where the cutoff needs to be. Like I actually have like a really big problem with like the sperm banking, to be honest. And I know that like, I know that it's used for like lesbian reproduction stuff and stuff like that, but I just think that like intentionally cutting children off for like entire branches of their family is wrong. You know, I think that the in vitro stuff where it's just like, you know, millions of shots and you have these frozen embryos that get tossed out and you pick them out and you do we're just doing too much. We're doing too much. We're doing too much. There's too many children who need homes. We're doing too much, guys. Children are not an accessory. They're not a human right to have one. They're not a toy.
Majority of the patients, they are going to lose completely the sensation in the nipples. Because we are disconnecting the nipple completely off and reducing the size and the thickness, we are placing them back in. Most of the times, their nerves do not grow in, and therefore, they will be completely numb or somewhat numb.
This is so disgusting, you know. I hate these people. I gotta go to bed. I gotta go to bed. God, guys.
How are you all doing? How's your
It's horrifying. This is horrifying. And you know what the saddest part is? Can you imagine trying to take care of these people in like 30 years from now? You know, yeah, I mean, listen, but you know, I'm also very against like the whole hookup culture. With that being said, I'm also fully against like getting pregnant off of like hookups. I'm very against hookup culture. I'm very against casual sex, period. Because that's also playing with children, right? There's plenty of women who are just having children and, you know, recklessly. And I'm not speaking from some high horse. I've fucked random people. Trust me. Like, I'm just saying, you know, and now looking back as I'm older, I really wish that I hadn't been indoctrinated into a hookup culture. Thank God I never got pregnant that way. I know other women who have. I've had scares before and stuff like that. It's wrong. This isn't how we build a society. I think that children should be, you know, conceived like thoughtfully and consciously, and I don't think that, you know, women who just should not be going out and just like, you know, men and women should not just be going out and fucking and somebody gets pregnant and, you know, who the guy, who knows if he's involved in all this sort of shit, all of it. Like we need to just tighten the fuck up. Tighten the fuck up. I know people are gonna get mad that I said that. I just still, guys, I just think in general, like I said, no, I mean, I don't know. It's not something I've given like super mega thought to. I think it's reasonable to say that it might not be ethical to choose to eliminate an entire half of somebody's, you know, family tree just because we all, you know what I mean, we want to go around like are the natural reproductive ways that we do things. There are a lot of children, and it has nothing to do with whether or not that I think that two lesbians or two women or two men can properly parent a child. Absolutely. Absolutely. I just don't know that if you know, child has an inherent biological side to them that they, you know, it's a good idea to just cut them off from that. No, I think that I mean, I think grandparents can raise kids, you know? I think that kids really just need stability and love. They really do. They need stability and love and like commitment, and they need strong role models from both sides. I'm a single mom. My you know, my ex-husband is abusive. I can't have him around us. He's not involved in whatever, but I have, you know, men involved in my kids' lives, right? So, you know, they're my brother and my dad and things like that, and my boyfriend and things like that. And I just think we're doing too much, guys. I think we're doing too much. And kids are getting hurt. Kids are getting hurt. Oh, cringe. Yeah, hookup culture is totally cringe. It's gross. It's disgusting. Do I think 21's too young to have a child? Yeah. I was 23 when I had my first kid, and I'm very glad I was young because I ended up getting cancer and I wouldn't have had all the children that I've always wanted. A big family. 4 kids is perfect. I'm very happy. I have 2 boys, 2 girls. It's perfect. I love my family. I'm very blessed. I thank God every day that I had my kids young, because if I didn't, I wouldn't have had them. But I do think that like that the chances of me getting cancer, like I couldn't have foreseen that, and I'm very lucky, but I do think it's kind of young. But I don't know everybody's life, you know? I don't know everybody's life. I think that you should make sure that you have financial options and stuff, so you don't get stuck dependent on somebody. That's a dangerous position to be in. Swiping is so depressing, I tried doing the online dating thing. I like met my boyfriend in a really weird way, and like I was not actually my boyfriend. Okay, my boyfriend was like totally like just like he was junk food, right? Like total junk food. Just because literally I was like, he's hot. I like was trying to justify it to my friend. I was like, ew, no, I'm not gonna like him. Ew. He's just really hot, and he comes over and he'll hang out with me for an hour, like late night, and like he leaves. I like tell him like, all right, you gotta go because I'm gonna go to bed. You're not allowed to stay over. And then it was like I did that with him for like months, and then like we like ended up hanging out all day one day, and then like I like really like it was fun, and then I like got attached to him because he's like really nice and like really helpful, and he used to come over and like clean my house for me for like no reason. I would come down like, oh my God, he would have like done all these like chores for me that I like didn't ask him to do. He would like clean the whole house and like was always doing stuff for me that like no one ever does, just like lightening my burden. He's really like a rare human specimen, complicated person, but he's a really good person. But yeah, I did the online dating thing for a little while. That shit made me want to die. And then no one looks like what they look like on their pictures. You see them and you're just ugh. I hate dating. I'm tired. I'm like an old person. I don't like going out late at night. I don't like other people in general. I'm like kind of irritable, and I'm like set in my ways. I don't want to dress up. I remember one time I went out with this one guy, and I like got super dressed up, and I like looked all sexy and cute. I let him like see my outfit for like an hour, and then I went and changed. I came in, I was like, wait, what did you do? I was like, oh, well, you like saw the outfit. I like put on like jammies. I was like, yo, my bad. Like I'm just like I want to be comfortable. Like you saw what I look like, great. Like I'm done. I just want to be comfortable in life. I don't give a fuck anymore. Yeah, dating sucks ass. Dating sucks ass. More else to kick him out than he'll. No, you know what it was? Because I just refused to like I think he really liked how stable my life was and how much I didn't need him. And I was very strict with my boundaries. He was not allowed over. He was only allowed over at very certain times. He wasn't never allowed upstairs. I was really strict about him not coming upstairs. He wasn't allowed to meet my kids for like the first year and a half. I like had all these like really strict rules and boundaries, and I could go like weeks without talking to him, and I like didn't care. And I think he was really used to people being like really overly clingy to him. And then he was like trying to just kept doing stuff to like impress me, I guess. But like, and then it like turned into he just is like he's like a very like he's like a hardworking kind of person. He like painted my whole I came downstairs. He like painted all my like house. I was like, oh wow, thanks. I was gonna pay someone to do that, but like thanks. He like cleaned. He would mop my floors. Like all these like weird chores, like do my dishes and stuff. I'm like, oh, like wow, thanks. Like put my laundry together. I was like, hey, listen, if you want to do all that kind of stuff, he's really, really nice to me. He's like really nice to me. And I'm like kind of like the main one. He's really nice to me. And that's why I always try to tell women. Women think that they need to like drop their boundaries to get men to like, no, the fuck you don't. Actually, having boundaries makes men wanna work for something. They want to like prove themselves. It doesn't feel good. It's like getting a reward for like not working or not doing anything. It's okay, great. Yeah, great. I got the medal. But it's like people want to achieve something and feel like it was because they did all this stuff and proved themselves and did all this stuff. I mean, I really made him like, and I didn't mean to. I just didn't need anybody. I was kind of happy in my own little world. I was like happy the way that I was. He was dick on demand, and I'm sorry to put it that way, but he really was. It was like once in a while I'd let him come fuck me, and then I didn't, and I know that that's not the most romantic thing in the world, but whatever. I was very happy and content in my life, but then he like came over and like would like try to like do all this stuff to like impress me, and I like didn't care for a while. Then we hung out all day one day, and then I was like, he's like my favorite person, and then we started hanging out more. He's literally like my best friend. And I really like him as a person. And he does a lot for me. And it's really good still because I have boundaries. I still don't let him live here. You know what I mean? And we get along really well. And we've been together for, 4.5 something years. Been together for years now. Get along really well. And he's my family. My dad loves him. My parents love him. Everybody, my whole world loves him, but I also don't let myself overdose on him. Like, I'm fine without him. I'm really okay. If he's not even here right now, I'm fine without him. And I think that that's really important. You have to be fine without them. Anyway, I know. Oh God, I know. All right, guys. Sorry, it's getting late. I'm really tired. I love you guys. Oh, God, that was one fucking shit show, wasn't it? Cleaning is I know. No, his love language is service. Like what he does to, like, show love is, like, do service for people. And I guess it must be my love language because I love him for it. I don't need a lot of stuff. If he helps me and, like, makes me feel like he was the first man to ever, like, contribute to my my day-to-day stuff like that, and I'm like, wow, thanks. Like, no one ever does that stuff for me. Like, that really like means a lot. He went and got my car fixed. He'll just do it too. He won't even ask me. He paid to get my car fixed. He, like I said, he would paint downstairs, and like this is still when we were just like Netflix and like chill. You know what I mean? I wasn't really doing anything for him. He would clean my house. He like sends me money for no reason, and I appreciate him for it because I think he knows that like I do a lot. I work hard, So I'm very like appreciative. He's like my favorite person. All right, I'm gonna go. I love you guys. I love you guys. I love you guys. Oh, I love you guys. I'm out of here. Good night. I love you. Thank you for hanging out with me. Bye, Rose. Bye, Lisa. Bye, Meg. Bye, Sarah. Jean. Bye, Reverend. Bye, Judy C. Bye, Voyeur. Bye, Space Case. I